Good day, ma'am. So I'll be performing the abdominal assessment. So before that, I'm going to introduce myself first to my client. So sir, ako yung restaurant, sir. Bali mo Anton, birthday.
August 13, 2019.
Kaya na, sir. Pwede ko ba? I-room siya mo clothes. Done. Ayan, sir. So the purpose of this is to evaluate the structure in the abdominal, abdominal quadrant, so skin, stomach, bowel, spleen, liver, and aorta, and bladder. So the first procedure is to inspect skin coloration in the abdominal. So the color, there's no discoloration of the abdominal skin of my client, so which is normal and no redness or inflammation noted. Next is we're going to note for vascularity of the abdominal skin. No scattered fine veins are visible. The next is we're going to note for striae or stretch marks. So there's no stretch mark visible in the abdominal skin of my client. The normal for the stretch mark color is like pinkish or pinkish, something like that. The next is to inspect for scars. So the abdominal skin looks smooth and firm without any scars. And next is assess for lesions and rashes. So the abdomen is free from lesions and scars. And yeah. And next is inspect for umbilicals. The umbilical skin tone is similar to the surrounding skin tone of the abdomen. And next is assess contour of the umbilicus. So the assess contour for umbilicus, it is recessed, inverted, or including no more than 0.5 cm, is round or conical. Then inspect for the abdominal contour. Look across the abdomen of the client by sitting at the bedside of the client. Then eye level. The abdomen is flat and rounded or scaphoid, usually seen in adults. And yeah. Next is to assess for abdominal symmetry. The abdomen is symmetric. Asymmetry may be seen with an organ enlargement or masses. And next is inspect for the abdominal movement. The abdominal respiratory movement movement seen especially in male clients when the clients breathe. And next is observe for aortic pulsation and peristaltic wave. There is a slight pulsation of the abdominal aorta, and normally peristaltic waves are not seen, although may be visible in very thin people, like as my client. And next is for auscultation. To auscultate abdomen of the client when I will rub the left arm against the palm. And then apply apply pressure and place the diaphragm starting with our right lower quadrant in a clockwise, and then auscultate at least 1 minute per quadrant. A series of intermittent soft clicks and gargles are heard at the rate of 5 to 30 per minute. Hyperactive vowel sounds may be heard normally. Sound that may be heard with prolonged gurgles, and characteristic of the stomach growling. These hyperactive vowel movement sounds are called borborygmi. Next is auscultate for vascular sound. So by using the bell of the stethoscope to listen for low pitch like sound. Normally breweries are not here. Brewery kay Cohen. So this is a turbulent of obstructed blood flow in the artery. And next is auscultate for friction drag over the spleen, liver and spleen. Listen to the right and lower rib cage by diaphragm. No friction wrap over the liver and the spleen. Percent. Next is to one. Next procedure is the percussion. So percuss for tone, lightly and systematically percuss all the quadrants, and two sequences are illustrated. Two sequences. Generalized temporary predominates over the abdomen because of air of stomach and intestine. Normally, dullness is heard over the liver and spleen. So next is percuss the spine or height of the liver by determining its lower and upper borders. So, the lower border of the liver dullness is located at the costal margin, 1 to 2 centimeters below. And next is repeat the percussion in the liver at the mid sternal line. The normal liver span at the MCL is 4 to 8 centimeter. So next is next procedure to percuss the spleen. So begin at the posterior left mid axillary line. The spleen is an oval area of dullness, approximately of 7 cm wide near at the left of the tentrip and slightly posterior to the mid anterior mid anterior line. So next procedure is perform light next is to perform blunt percussion on the liver and the kidneys at the kidneys. So okay, that's it. Normally, sir, ay sakit na bagyan, sir. So, normally, no tenderness is elicited. Tenderness elicited over the liver may be associated with inflammation or infection. So next is next procedure. Next is to perform light palpation. The abdomen of my client is non-tender and soft, and there is no gargling. So next is deeply palpate all the quadrants to delineate the abdominal organs and detect for masses. So normal tenderness is possible over the xiphoid and aorta cecum or sigmoid colon, and varies with a deep palpation. Severe tenderness or pain may be related to trauma or peritonitis or infection, tumors, or enlarged disease organs. So next is to palpate for masses and note for the location and size. There is no palpable masses are present. And next is palpate for the umbilicus and surrounding area for swellings and bulges or masses. The umbilicus and the surrounding are free from swelling, bulges, or masses. Next is to palpate the aorta. Use your thumb and first finger or two hands to palpate deeply in the epigastrium, slightly to the left midline to assess the pulsation of the abdominal area. The normal aorta is approximately 2.5 to 3 centimeters wide, with moderate, strong, and regular pulse. A wide bounding pulse may be felt with the abdominal aortic aneurysm. So next is to palpate the liver. So note the consistency and the tenderness. The liver is usually is not palpable, although it may be felt in some thin clients. And a hard firm liver may indicate cancer, or nodularity may occur with tumors and metastastic cancer or late cirrhosis or syphilis. So next is to palpate the spleen. The spleen is sendum at the left costal margin. Rarely the tip is palpable in the presence of low and flat diaphragm, or deep diaphragmatic descent, or with deep inspiration. So a palpable spleen suggests enlargement up to 3 normal size, which may result from trauma or chronic blood disorder and cancer. So next is to palpate the kidneys. So to the kidneys to the right kidney to right kidney. The kidneys are not palpable sometimes. Sometimes the lower pole of the right kidney may be palpable by the capture method because its lower position, and an enlarged kidney may be due to a cyst or tumor or hydronephrosis. So the next procedure is to palpate the urinary bladder. Normally, the bladder is not palpable. The distended bladder is palpated as smooth and round and somewhat firm and mass extending far as the umbilicus. It may be further validated by cushion tones. So next is so that's it. So thank sir, thank you for your concern operation. So the document, sir, will be one. Tora privately and to the medical team. So, sir, have a good day.
Thank you.